Good day, ma'am. I am your student nurse, Marmarta Villas from BSN 2C. So, for today, I am going to do my return demonstration on inserting and removal of urinary catheter. So first, we need to wash our hands to prevent from any contamination and provide the patient a privacy by closing the doors, windows, and curtains. So prior to the conduct of the procedure, we need first to verify the doctor's order for the catheterization for us to ensure that we have the right patient and right procedure to be done. So I'm going to introduce myself to my client and explain the procedure. Good day, ma'am. I am your student nurse, Marmarta Villas. So may I know about your full name, ma'am? So when is your birthday?
January 2011.
Your age?
I'm
So for today, ma'am, the doctor ordered you to have a catheterization. So I am going to insert a tube through your urethra and connect to your bladder for you to excrete your urine. Would that be okay with you?
yes.
Next is we position the patient prone to semi-upright with knees raised. Apply gloves and inspect the perineal area, erythema, drainage, and odor. Also assess the perineal anatomy. Okay, ma'am, so I am going to inspect for the perineal area, erythema, drainage, and odor, okay? Okay, so I observed that there is no abnormalities and everything is normal. So after assessing, I'm going to remove my gloves and perform hand hygiene. Next is gather all the necessary equipment that we will be using for the procedure. So I have here my sterile gloves, my drape, a waterproof pad, and a catheterization kit filled with a fully catheter. Check for size and type of catheter and use smallest size of catheter if possible. Urinary bag, cotton balls with cleansing solution, a forceps, lubricant, a securement device, and a syringe that is pre-filled with sterile water. Place a waterproof pad under the patient. Position the patient depends on gender. Place a blanket or sheet to cover the patient and expose only required anatomical areas. Okay, ma'am, so I am going to put a waterproof pad underneath you, okay? Assume that we already washed the perineal area with warm water and soap. Ensure adequate lighting for better visualization. If you are using an indwelling catheter with closed drainage system, attach the urinary bag to the bed and make sure that the blank is closed. Perform hand hygiene. Next is we need to apply sterile gloves using sterile technique. Drape the patient with drape found in catheterization kit to expose the perineum of the patient. Lubricate tip of catheter using sterile lubricant included in tray. Then check balloon inflation using a sterile syringe. Clean the perineal area as follows. Okay, so we're going to start straight from the clitoris to the anus. Next is the labia majora. Then, its opposite side. The next is the labia minora. And its opposite side. Next, I am going to place the sterile tray between the legs of my patient and I am going to use my non-dominant hand to spread the vagina and my dominant hand to grab the catheter. Then make sure that the catheter is lubed before inserting it. Insert catheter slowly and gently until urine flows from catheter. Next is I am going to slowly inflate the balloon after inserting it. So after inflating, we're going to pull gently the catheter until we feel resistance and advance it again. Connect urinary bag to catheter using sterile technique and secure catheter to patient's leg using securement device. Then attach the urinary bag to the bed. Dispose the supplies that we use following the agency policy. And cover the patient using a blanket. Remove gloves and perform hand hygiene. Okay, good day ma'am. I am Marmar Cabigas, your student nurse for today. So the doctor ordered you for the removal of the urinary catheter. Would that be okay with you?
Yes.
Next is I am going to perform hand hygiene and put on my clean gloves to prevent from any contamination. Next is we're going to measure, empty, and record the content of the urinary bag. Then remove our gloves. Then perform hand hygiene and apply a new one. Insert syringe in balloon port and drain fluid from balloon. Verify balloon size on catheter to ensure all fluid is removed from balloon. Pull catheter out slowly and smoothly. Wrap used catheter in waterproof pad or gloves. Unhook catheter tube from urinary bag. Provide perineal care as required and reposition patient to a comfortable position. Okay, so next I am going to provide a perineal care to my patient. So I'm going to start straight from the clitoris to the anus. Next is the labia majora. And its opposite side. Then next is the labia minora. Then its opposite side. Discard the equipment and supplies according to agency policy. Then finally, we can now remove our gloves. Then perform hand hygiene. We can now document all the data that we've gathered from the procedure according to agency policy.